Hey there, my name is Maria. I'm a registered nurse in the Oncology Intensive Care Unit. And this project will be discussing the organizational structure and model of care delivery at Atrium Wake Forest Baptist Medical Center. The purpose of this presentation is to examine how the hospital's organizational structure influences our leadership, communication, interdisciplinary collaboration, and patient care. I will begin with an overview of the organization, explain the structure and organizational chart, and discuss how that structure supports patient care. I'll also review communication methods and barriers to those, and conclude by describing the model of care delivery used within the oncology ICU and at Wake Forest Baptist. Understanding the organizational structure is very important because healthcare is much more than direct patient care. Every decision is made by leadership, and every communication between healthcare professionals and every collaborative effort among disciplinary influences patient safety and the outcomes. As I stated earlier in this presentation, I am an RN at Atrium Wake Forest Baptist Medical Center. It is a medical center located in Winston-Salem, North Carolina, and is part of Advocate Health. Advocate Health is one of the largest nonprofit healthcare systems in the United States. Wake Forest Baptist is an academic medical center. This means that they are also a teaching hospital. This organization integrates patient care, education, research, and innovation. It serves the surrounding communities, and the hospital provides highly specialized care for patients across North Carolina and other states throughout the United States. The Oncology Intensive Care Unit treats some of the hospital's most critically ill patients with a cancer diagnosis. Many patients require complex therapies such as mechanical ventilation, CRT, pressure support, chemotherapy complications like Stevens-Johnson syndrome, and end-of-life care. Because these patients require input from a lot of healthcare professionals, a clearly defined organizational structure is essential to ensure that communication remains effective and care is coordinated among everyone. This is the organizational chart for Wake Forest Baptist Medical Center. This organizational chart illustrates the leadership structure relevant to nursing practice within the Oncology Intensive Care Unit. At the highest level is Advocate Health's executive leadership. This leadership establishes the organization's missions, helps plan priorities, they oversee financial oversight, and long-term goals for every Advocate Health property. Leadership then continues through Atrium Wake Forest Baptist, executive administration, and nursing leadership. This would be the same if it was a different Advocate facility. Within nursing, the chief nursing officer at Baptist oversees professional nursing practice across the organization. Continuing on, we have our critical care leadership, and this would be our oncology ICU nurse manager. It also would be equivalent to the nurse manager in trauma ICU, CV ICU, neuro ICU, surgical ICU, and regular medical ICU. These managers are responsible for the daily unit operations, staffing, quality improvement, employee development, and compliance with policies and procedures. Continuing on, assistant nurse managers and charge nurses provide day-to-day operational leaderships by coordinating staff assignments, admission transfers, and serving as a great resource throughout each shift. They also keep up to date with any and all new policies. Bedside registered nurses provide direct patient care while collaborating with members of the interdisciplinary healthcare team like physical therapy, respiratory therapy, occupational therapy, and others. I want to point out that the interdisciplinary team that includes physicians, NPs, PAs, respiratory, pharmacists, PT, case managers, social workers, chaplains, lab, radiology, etc., does not report through nursing leadership. Instead, these disciplines work collaboratively with nursing to provide holistic patient-centered care. Although the organizational structure follows a traditional hierarchy, patient care depends on collaboration across multiple healthcare professions. Now let's discuss this organizational structure and relationship within the organization. Wake Forest Baptist uses a hierarchical organizational structure with clearly defined leadership responsibility. This structure establishes accountability, supports decision-making, and provides an organized chain of command for addressing issues clinically and operationally. Executive leadership establishes organizational goals and strategic priorities, while nursing leadership translates these goals into policy, staffing plans, improvement, and practice standards. Unit leadership, including nurse manager and charge nurses, oversees the daily operations necessary to provide safe and efficient patient care. While the organization follows a hierarchical leadership model, patient care relies heavily on collaboration between disciplines. Bedside nurses work closely with physicians, nurse practitioners, pharmacists, respiratory therapists, PT, OT, and many other disciplines to develop and implement individualized plans of care. Baptist also supports shared governance. This allows bedside nurses to participate in professional practice councils, quality improvement initiatives, and evidence-based practice projects. Shared governance recognizes that nursing provides a greater patient care that have valuable insights that contribute to improving patient outcomes and improving the organization as well. By combining the structured leadership with the interdisciplinary collaboration, this allows Baptist to maintain accountability while encourage teamwork and continuous improvement in our patient care. So why this organizational structure supports quality patient care? An effective organizational structure chart directly contributes to the quality and safety of every patient and in patient care. First, clearly defined leadership responsibilities allow healthcare professionals like RNs to understand their individual roles and responsibility. This reduces confusion, improves personal accountability, and promotes timely decision-making during every shift and during emergent situations. Secondly, the organizational structure encourages interdisciplinary collaboration. In the oncology ICU, patient care requires coordination among many different healthcare professionals with different areas of expertise. A well-organized structure allows each discipline to contribute knowledge while working toward a goal to improve that patient's outcome. Another aspect is communication. When reporting, relationships and responsibilities are clearly defined, communication becomes more efficient. Nursing knows who to contact when concerns arise, and patient information can be communicated quickly and appropriately. Finally, shared governance supports quality improvement by encouraging nurses to participate in the organizational decision-making. Nurses who provide direct patient care can identify places that need improvement, patient safety concerns, and overall clinical outcomes. Research has shown that positive work environments with collaboration, good communication, and supportive leadership contribute to improved patient safety, higher overall nurse satisfaction, and better organizational outcomes. Although the organizational structure provides the framework that allows healthcare professionals to work together more efficiently while maintaining a patient-centered approach to care. Communication throughout the organization. Communication is one of the most important factors influencing patient safety and quality of care. In a large teaching hospital like Wake Forest Baptist, effective communication ensures that information is shared accurately among healthcare professionals, leadership, patients, and their families. Several methods of communication are used throughout. One of the most common is the SBAR, which stands for Situation, Background, Assessment, and Recommendation. This provides a standardized framework that helps healthcare professionals, specifically RNs and charge nurses, communicate patient information clearly and efficiently to the providers, particularly during changes in condition or when contacting for an emergent situation. Another method is bedside shift report, where nurses exchange information during shift change while involving the patient whenever possible. This process involves continuity of care and allows the oncoming nurse to verify important information directly with the patient if the patient is able. Within the oncology ICU, interdisciplinary rounds are one of the most valuable communication tools. During rounds, physicians, nurses, pharmacists, respiratory therapists, etc., discuss each patient's condition and collaborate to develop a comprehensive plan of care. This approach helps ensure that everyone is working towards the same plan of care and reduces the risk of fragmented care. Additionally, communication methods include the electronic health records, secure messaging, daily huddles, unit meetings, and established chain of command. These communication strategies promote collaboration, improve patient safety, and supported coordinated care throughout Wake Forest Baptist. Barriers to communication. Although healthcare organizations use many communication strategies, several barriers can interfere with effective and quality communication. One of the most significant barriers within the critical care is the high acuity of the patient population. Patients in the oncology ICU often experience rapid changing of conditions that require immediate intervention. During these situations, healthcare providers must prioritize multiple tasks simultaneously, and this increases the risk that important information can be delayed and overlooked. Another challenge is the number of healthcare professionals involved in caring for one patient. And oncology ICU patients may have consultations from oncologies, infectious disease, nephrology, pulmonology, respiratory, palliative, etc. Coordinating communication among numerous disciplines can become complex if information is not consistently shared. Staffing shortages, interruptions, fatigue, burnout, and frequent admissions and deaths or transfers may also contribute to communication breakdowns. Shift changes represents another valuable time because incomplete handoffs can lead to missing or inaccurate information, especially when a patient is decompensating at shift change. Finally, a professional hierarchy can sometimes discourage team members from speaking up when concerns arise. Creating an environment where nurses and other healthcare professionals feel safe to ask questions and advocate for their patients is essential for improving patient safety and overall teamwork. Recognizing these barriers allows organizations to implement strategies that promote open communication and reduce preventable errors. Model of care delivery. The model of care delivery used within oncology ICU is best described as patient-centered interdisciplinary care. The patient and the family remain at the center of every decision. While the registered nurse assumes primary responsibility for coordinating the patient's nursing care during each shift, outcomes depend on collaboration among other healthcare professionals. Nursing continuously assesses the patient, administers medications, performs intervention, and monitors changes, provide education, and advocates for the patient and their family. Nursing also communicates these findings with physicians and other disciplines to ensure the care of the patient remains appropriate. However, patient care is far beyond nursing. Physician and advanced practice providers provide direct medical treatment. Pharmacists assist with the medication management. Respiratory manages ventilator support and BiPAP. PT and OT address mobility. Dietitians optimize nutritional status, and case managers and social workers coordinate planning and community resources if needed. The collaborative approach allows each discipline to contribute its knowledge while working toward a goal of delivering safe, evidence-based, holistic, patient-centered care. In the ICU, where patients often have multiple complex medical issues, no single discipline can provide comprehensive care independently. Instead, high-quality patient care depends on effective teamwork and communication among the entire healthcare team. Care delivery in the oncology ICU. The importance of interdisciplinary collaboration becomes especially evident in our unit. Patients admitted to this unit often have life-threatening complications related either to their underlying cancer diagnosis or the treatments used to manage their disease. Many require advanced therapies such as ventilation, dialysis, CRT, vasopressors, and aggressive treatment of sepsis or tumor lysis syndrome. Unlike other ICU populations, these patients require ongoing collaborations between critical care specialists and their oncology teams if they're able to continue treatment. In addition to treating acute illness, the healthcare team must also continue and consider the patient's cancer diagnosis, treatment plans, prognosis, and long-term goals of care. As an oncology ICU nurse, I have experienced how important communication and teamwork are in managing these complex patients. Treatment decisions are often required input from several specialties, and nurses play a central role in coordinating that care while communicating changes in patients' conditions and advocating for the patients and their families. Because these patients are high acuity and experience rapid changes in condition, communication with families is equally important. We often help facilitate discussions regarding treatment options, goals of care, symptom management, and end-of-life decision-making while collaborating with palliative, chaplain services, and social work when appropriate. Overall, the oncology ICU demonstrates how organizational structure, communication, and interdisciplinary collaboration work together to provide comprehensive and holistic patient care. In conclusion, the organizational structure of Wake Forest Baptist provides the framework necessary to deliver safe, coordinated, and high-quality patient care. The hospital's hierarchical leadership structure establishes accountability and clearly defines leadership responsibilities, while interdisciplinary collaboration allows healthcare professionals from multiple specialties to work together. Communication remains one of the most important components of this structure. The SBAR, bedside shift report, rounding, and EPIC record and help improve collaboration and reduce the risk of communication errors. Within the oncology ICU, these principles become even more important because patients often require highly specialized care involving numerous healthcare professionals. As an RN, we serve as patient advocates and coordinators of care, ensuring that information is communicated accurately and we remain patient-centered. Understanding the organizational structure is not only for leadership, it is essential for every nurse because it influences communication, teamwork, decision-making, and the quality and safety of our patients.